What's going on, everybody? Welcome to another live podcast, Mic Drop Mentorship recording. Thanks for joining. I hope your Sunday's going well. I know that finals are coming up soon for a lot of you, and the semester's coming to a close. So make sure that you take care of yourself. Make sure you enjoy the weather if the weather's good where you're at. Make sure that you're taking care of your mental health, all that good stuff. Because we know at this time you're starting to feel that anxiety, that pressure, that chokehold on you. So make sure everything is in place and make sure you're not killing yourself on this pre-PT journey that you're on. But on this one, Rob, what's going on, my man? Thanks for joining. But on this one's pretty simple. This one's pretty simple. And I want to talk about what physical therapy really is. Or can you guys even explain it to a point or understand it to a point where you understand it deep enough where you can explain it to others that makes sense and that's easy to understand. Because when we're able to do that, that means we actually know what we're doing and we actually know what we're talking about. And a lot of times, especially myself thinking back as a pre-PT, if someone were to ask me this question, what is physical therapy? I would say what everybody else says. But here, that's not what we're really about, right? You guys ask us all the time, how am I different? Or how do I become different? How do I stand out? How am I unique? All that stuff. So when I was a pre-PT, if I was to answer this question, I would say, oh, we help people. Oh, we help people move better. You know, we're the movement specialists. We help people walk again. What is physical therapy really? Can you really explain it in a fashion that paints us in a good light and is simple enough for other people to understand? Like, oh, okay, that makes sense. So that's what I really want to do here. I'm on early today, a little bit early today, because I'm going to see this movie everyone's talking about. I got yelled at work the other day. They were like, you got to see this movie. You mean you haven't seen Infinity Wars and you're trying to go see this other movie called Endgame? I was like, well, it's just a movie, so don't get mad. Don't spoil it. If you hop on this live stream in a few hours, I'll know exactly what happened. And hopefully I can keep up with what's happening in this movie because I've seen the Marvel movies like, here and there just because people are like, oh, come out and see the movie. So I'm not that invested into it, so hopefully I can keep up with it. So I know a lot of you will see this on replay, but physical therapy, what is it? Like, what can we say it is? Like, what do physical therapists do? Throw it in the comments, throw it in the replay comments, put it down. I'm interested. What is it to you? What does it really mean? If you were to be asked this question, what would you say? Justin, what's going on? Thanks for joining. What would you say? I already told you what I would say or what I was thinking as a pre-PT, but now as understanding it a little bit better, to the point where I can explain it a little bit further in depth to other people, I would say physical therapy, or what I say now, physical therapy or physical therapist, optimize movement and function to its maximum potential before or after an injury. Done. Period. Like, that's it. Why complicate it even more? Why throw some other words and make it more fancy just to make us look smart? But that's what I would say in its simplest form. Physical therapy, physical therapists do what? We optimize movement and function to its maximum potential before or after an injury. Easy, simple. That explains this pretty well without overcomplicating it. Natalie, what's going on? And to go deeper into this, what is an injury? What does that mean? What can an injury be? An injury can be almost anything. A car accident, a congenital injury, brachial plexus injury, a stab wound, a gunshot wound, a spinal cord injury, someone falling off a roof, someone falling or slipping on a curb, someone just falling from their walker and can't keep their balance. It could be a stroke. It can be a lot of things. It could be your ankle injury. It can be your knee pain. It could be a lot of things. It could be someone's pregnant and their pelvis is doing all this weird stuff. It could be a pelvic floor problem. That's where these subsets come into play. And that's how we as physical therapists or future PTs, aspiring PTs, can really step in and solve these problems for other people and optimize their movement and function to its maximum potential, either before their injury occurs or after. So now let's get a little deeper into what physical therapy really is and how I like to explain it. What's going on? Chipo, hope I'm pronouncing that right. Connor, Pepe, what's going on? Thanks for joining, guys. But how I like to explain this is like fighting. Fighting is fighting, right? But under fighting, there's different fighting styles. Let's just say martial arts. Then inside martial arts, there's a lot of subsets like Taekwondo, jiu-jitsu, karate, a whole bunch of other stuff going on, under that. So the same thing is like with medicine and healthcare. Okay, you got this big spectrum of healthcare and medicine. Then under that is different specialties. Okay, physical therapists, OTs, speech, surgeons, physicians, osteopaths, whatever that is. That's what's underneath that. Then inside of that martial arts, if we're saying martial arts is physical therapy, under that is all these different subsets. Okay, pain specialists, pelvic health, orthopedics, amputees, neuro PTs, the list goes on and on. So that's what it's really like. That's the simplest way, that's the simplest analogy I can think of. Okay, fighting is fighting. But under that, different styles of fighting, martial arts. And under martial arts, there's different types of martial arts. So in healthcare, there's medicine. Underneath medicine, there's different subsets. There's different specialties. Physical therapy is one of them. Then inside of physical therapy, there's a lot of subcategories as well to solve the problems of maximizing function and movement to its maximum potential before or after an injury. I remember agree with the PT being described as a profession that changes. Oh yeah, I talked about that. I don't know, a couple weeks ago, and that's my last point. Justin, you be listening. I respect that. But I'll go into that later. But yeah, absolutely. I'll talk about that in a bit. But yeah, we can go into so many subsets and so many specialties. But because we have the solutions to those problems, because of all the schooling, all the money we're paying, all the knowledge that you're about to acquire, we now have those skills and those abilities to treat and solve solutions or to bring solutions to those problems. So we have everything. What do we got? You guys can name those off for us. Pain specialists. I mentioned neuro PT. That can be anybody from a stroke to a person with cerebral palsy to Parkinson's, neural conditions that affect the musculoskeletal system. We have amputees. We have workman's comp. We have wounds care. We have cardio specialists, cardiopulmonary specialists, because the heart is a muscle, right? If someone has a heart attack, what? Like this. Make it a lot more simple than it needs to be, or make it way less complicated than it needs to be. The heart is a muscle, right? During a heart attack, the heart is damaged. The heart is a muscle. What do we do after an injury to a muscle? We maximize function and movement to its maximum potential before or after an injury. So a cardiopulmonary specialist rehabs the heart muscle to its maximum potential after an injury. So we can do that to the heart as well. There's a subcategory, or there's certification, there's residencies for cardiopulmonary specialists. We got acute care, we got TMJ, we have geriatrics, we have biomechanics, the list can go on and on. But in these, most importantly, and that's what Justin was talking about before, I think the best way that you need to understand what we do as physical therapists is listen to what the patient is telling you, and listen to what they want and what problems they want it solved. Then you can go back into your toolbox and into your education and say, okay, I remember how to solve this problem for you. Now, because I know that, because I have those skills, because I have the solutions, let's solve that problem for you and get you back to your optimum or your maximum function and movement after your injury. So first you have to listen to what they actually want. First you have to dig deep and pull out from them, why do they really want this? Okay, yeah, I just want to be out of pain. No. Let's dive deeper. Let's have a deeper conversation so we can do what Justin just said. We can make that behavior change. Because if all they want to do is get out of pain, they'll be in your office for 3 visits, or until you can get that pain out of them, then they're on, then they injure themselves again, then they come back and say, oh, physical therapy didn't work, or they blast it on the internet, or they talk to their friends and say, oh, PT didn't work, I was out of pain, then it just came back. PT doesn't even work. Physical therapy is really nothing. I did, whatever my session was, and now I'm gone, and now the injury's back, or now the pain's back. But if we go deeper, if we listen, and if we dig out from them what they really care about, what they really want out of this whole experience, we can drill down on that behavior change to make that behavior change a long-lasting effect on their physical injury. Now, let's just say there's a 65-year-old man, he has back pain, and he's just like, oh, I just want to get out of pain. But if you dig deeper into his story and ask him more questions, why does he want to get out of pain? Because his wife is sick, and he's the only sole provider for his wife to take care of his wife. And if he goes down, his wife has nothing else to lean on and hold on to. So if we go and drill down on that problem that he has, that deeper problem outside of the pain. He wants to get out of this pain, not just because it feels better, but he wants to take care of his wife. We can drill down on that and say, okay, Mr. Johnson, let's make this happen so you can take care of your wife. Let's make this behavior change to impact your physical change so that your wife can get better because of you. That's what it really is that we do. Yes, we have all those skills. Yes, we can treat all these, different, ailments. Yes, we can treat all these different injuries. But if they're not locked in, if they're not buying what you're giving them, if they're not understanding what you're trying to help them change, they're going to be gone just like the wind. And our whole profession is just because it didn't work. I was out of pain and it came back. But I think the most important thing that we do within all these specialties is listen to the patient and make that behavior change for them, to make that physical change, to optimize movement and function, to get back to whatever they want to do. So I don't know if you guys thought of physical therapy like that before. I know I did not. Definitely not as a pre-PT. And just recently, within the last year or two, it really clicked for me that this is what we do. And before, I was just saying, oh, we're the movement specialists, we help people get better. Yeah, that's cute. But what is it that we really do? And can you explain it on a different level that makes sense to the outside public? Yes, it makes sense in your head, but can you articulate it in a way that the schools are like, man, we've never heard it articulated that way. We've never heard it come across that way. This person actually knows what they're getting into. We need them in our school. We need them as a physical therapist because they will be a fantastic clinician for the future patients and the future of our profession. So that's really it. Think about physical therapy on a deeper level. Think about what you're getting into as something more than just a career, something more than just a sentence that you've heard other people say. Make it your own. Articulate it in a way that makes sense to you so that it can make sense to other people. So that's really it. What is physical therapy? Do you know what you're getting into? And can you articulate it in a way that makes sense to the public so our profession can grow for the betterment of others and throughout healthcare? So that's pretty much it. Jeremy, thanks for joining. I'll see you at SSPT Live in what's today, the 26th or 27th? See you in about 30 days. It's going to be a party. Murtaza, I hope I'm pronouncing that correct. Layla, thanks for joining. Ashley, welcome to the fam. I don't know if you're still on, but welcome again to the Accepted System. Make sure you guys join the Accepted System. It's a party in there as well. We get you into PT school without wasting time or money. So hope you like this. Tag your friends here. Invite them to the podcast, Instagram page, YouTube. Everything that we talked about is for you and for the betterment of yourself and to help you get into PT school as stress-free as possible. Let's just see what's going on. Best PT is one who is able to create good relationships and more than just a professional that... Perfect. I love it. Make it your own. Chippo or Cheapo. I think it's Cheapo. I don't know. Correct me if I'm wrong, but yeah, absolutely. Make it your own. But yeah, thanks for joining everyone, and we will see you on the next live stream podcast, Mic Drop Mentorship. Tell your friends about pre-PT grind and that we help you get into school without wasting time or money. See you soon. Take care.